Hello, it's Paul Perito again. This is MTP number 67, and this is for Mike P. You know who you are, Mike. It's kind of a long question, so I'm going to try to distill it down. This fella's on his second implant, and he's 15 months post-op somewhere, and he's seeing he describes it as a depression in the gland/urethra, which to me sounds like he means an excrescence, meaning a possible erosion, or extrusion through the erectile body itself. When he goes further into his history. He says that he had severe Peyronie's disease before this, and his implant surgeon who did the two surgeries says it looks fine. And he says he's a great surgeon, and it sounds like he is because he was able to straighten out his penis on the first IPP. But he is concerned about this pending extrusion/erosion, okay? We like to describe these areas as a hernia, especially with Peyronie's disease, which is a global disease process where the lining of the erectile body is globally disturbed, and it can lead to the implant, which is super physiologic, trying to work its way out. And he says, what can I do to avoid ongoing erosion/extrusion? And what you need to do is you got to really make sure that implant, when you're not using it, is completely deflated. If it's left partially inflated, that implant's going to try to find its way out. If it does work its way out of the tunicle body, in the erectile body, that is, through the tunica, which is the lining, then you're going to have something done. And if you're in the hands of a dedicated implanter, these, let's call them hernia repairs, are fairly simple. So it sounds like you're in the right place. If your physician feels that it's not, a pending extrusion where he needs to do something, then you don't need to do anything, but make sure you keep it completely deflated. Today is what? Today's primaries day, right? So I have one message to Ted. Ted, keep your boots on. Have a good one.